Welcome back, dear viewers. The lung cancer is one of the most common types of cancer in the world and is celebrated in November every year. To educate about lung cancer and raise awareness, some risk factors increase the likelihood of developing lung cancer, such as smoking or exposure to secondhand smoke. To know more about the importance of lung cancer awareness, we are pleased to have with us today in the studio Dr. Mohammad Ghanbar, the pulmonary and critical care medicine, advanced lung disease and transplant specialist. It's really a pleasure to have you, Dr. Mohammad, and really an honor for us.
Thank you very much, and the pleasure is mine to be here. Thank you so much for having me.
Dr. Mohammad, definitely smoking always, you know, the most controversial topic in the world, you know.
Absolutely, yeah.
Yeah, and so why is November important for lung cancer awareness?
Absolutely. I mean, this is a very important topic, and I want to thank the whole KTV2 production team for actually raising the awareness and highlighting this month of November as being considered by the global medical community as being a focus to raise the awareness for lung cancer. Unfortunately, lung cancer has taken a lot of lives, both globally and locally. It's been attributed to around 2 million causes of death annually worldwide. Yeah. And in Kuwait, it's one of the top 3 cancers affecting the male population here.
That's true.
So it's important to dedicate a whole month, sort of say, as in relation with other cancers, to raise the awareness of people and try and highlight the burden of the disease itself. I myself have a very close family member who was taken away in a tender young age because of lung cancer. Yeah, so it's important to actually highlight this because it not only affects the patient, but it affects their families, their close relations, as well as the whole community in general. So what we're trying to do with the whole month of November is to try and raise the community's awareness to help maybe prevent the disease or help with the earlier detection and maybe better outcomes to benefit the whole community.
Definitely, this is a very noble work, honestly,
Thank
Dr. Mohammad, you know, to raise awareness and try to save your community, your country, your folks, your definitely family members, friends, and, you know, we all know since, you know, when we were youngsters, you know, definitely it was smoking is bad, try to avoid smoking, don't sit in rooms full of smokers, and definitely will be a second-hand smoker. Absolutely. And this came lately, you know. At the beginning, we had no, honestly, any idea and no clue about the second-hand smoker.
Sure.
And that was really something amazing to raise awareness about. So what are the causes of lung cancer, if we want to be precise?
Yeah, so I think, as you mentioned quite eloquently, smoking has become the prime focus of a lot of the healthcare professionals because of its many associated risks, not only cancer itself, but a lot of cardiovascular disease, a lot of neurological disease like stroke. But unfortunately, one of the main consequences of smoking, either directly or by secondhand smoke, so sitting next to individuals who smoke themselves, is unfortunately lung cancer. And it's been attributed to be the most significant factor leading to lung cancer. However, it's not, unfortunately, medicine is complex. It's not as straightforward as saying just regular smoking will lead to cancer, because there's a lot of other associated conditions may predispose. One of them is just the environmental factors. So either radiation that's present naturally in the environment, air pollution, which has been on the upstroke with the industrialization and burning of fossil fuels. Sorry, you wanted to...
I don't want to, I want you to continue, but I would just want to put an example for the radiation.
Yes.
In 1990, when the Iraqi occupation and invasion took place, the unfortunate, you know, this catastrophe, I remember there was a tank and everybody was, you know, taking pictures around it, and that tank was hit with a depleted uranium or whatever, these, you know, that causes radiation, and that caused a lot of cancer, especially aftermath of the, or after the liberation of Kuwait.
Yes, absolutely.
Do you agree on that?
I mean, you bring up a very good point, because there have been evidence that sort of global wars have been responsible for a lot of upticks and changes in both cancer rates as well as radiation, because not only would chemical warfare and other types of warfare, depleted uranium being one of them, be source of radiation itself, but the upturn in the soil and the destruction of the groundwork itself, there is natural release of radiation from the environment itself. But this alteration, because of the war zone, because of the warfare, actually might also sometimes increase or sometimes on a less likelihood decrease the amount of radiation. So I mean, these are all important factors, and it's important to be aware of them.
So you were continuing that there are other factors.
Apart from the environmental radiation, pollution, industrialization, unfortunately genetic predisposition is also one of them. So some some people have a genetic predisposition to develop the cancer. So while smoking is the primary risk factor for you to develop cancer, you should have a lot of individuals would have also some kind of genetic predisposition to develop them. Either so people with family history of lung cancers are more likely to develop lung cancer, as well as certain genes might predispose you to develop lung cancer. Unfortunately, medicine has not advanced to a stage where we can identify which genes will make you more likely to develop cancer. But there is research focusing on this matter, and hopefully maybe in the future.
It takes a while.
It takes a while.
So what are the types of lung cancer? So is there types of lung cancer?
Yes, so actually there are many.
That's a new for me, honestly.
Yeah, there are actually many different types of lung cancers, and this is primarily because your lungs and airways are made of many different cells. So the cells that are turning into cancer dictate what type of lung cancer you have. However, in a sort of simplistic way, they're split into two main different lung cancers, one of them being called non-small cell lung cancer, and this is primarily a non-small cell lung cancer.
Okay, non-small cell.
Yes, and this is primarily how they look under the microscope. When you look at the cells under the microscope, they don't appear small, so they call them non-small.
Non-small, okay.
These actually make the majority of lung cancer. Around quite close to 90% of lung cancers are made up of these. And then there are the other type, which is small cell lung cancer.
Small cell,
yes. So the cells are small when you look at them under the microscope. But they are still cancerous, and they make up around 10% of lung cancer. Yeah, so these are the two main types.
Okay, which ones would be easier for the patient?
So it's a complex question because
I mean, usually as a doctor, as a cardiologist or whatever your specialty, and you are treating somebody, you always like to have non-small or
so I'd rather have neither.
Neither. Okay,
but if I have to choose, you would choose non-small cell lung cancer because it's less aggressive and it's detected. When it's usually detected, it's not as widespread in the body as small cell would be. So small cell usually, once you detect it, it's more spread and it grows much quicker than non-small cell lung cancer.
May Allah protect all of us.
Inshallah, inshallah. Inshallah, none of your viewers get
all the cells, of cancer.
Inshallah.
What are the symptoms of lung cancer, doctor?
So the symptoms are quite vague, unfortunately. So
vague.
So they're vague, and I'll expand on this because I think it's important. Although we're trying to increase awareness, we also don't want to frighten people. So the symptoms are usually just a cough that is long-standing, doesn't go away quite quickly. So it usually they would call it a long-lasting cough, at least more than 3 weeks. Sometimes, sometimes patients might cough up blood or spit up blood with their cough. There might be some voice changes. They might develop some chest pain anywhere in the chest. And then depending on where the cancer is in the lung, you might have certain specific symptoms. So if the cancer is more on the top of your lungs, near your sort of upper rib cage, it sometimes can include a lot of vessels, blood vessels, and nerve endings that run in that place. So patients might come with swelling of their face, they might come with weakness in their arms, or a sort of drooping of their eyelids.
So these are like the complications that accompany with the cancer?
Not usually. These are primarily the main symptoms that they come.
So what are the complications?
So one of the main complications that come with these cancer is that if the cancer spreads from the lung to another body organ, so it might leave the lung itself and go around the lining.
Like contamination.
Exactly. So we call this metastasis, or the spread of the cancer outside the lung.
Yeah.
So it can affect your brain, it can affect your bone, it can affect your skin, it can affect your colon. And according to where it spreads, it will cause different symptoms. So if it unfortunately goes to the brain, you might develop seizures.
And how would you diagnose cancer?
So we usually diagnose it initially by evaluating the symptoms of the patient and seeing whether they correlate with cancer or not. So this is why it's important. So not everyone with a cough will have cancer. Not everyone spitting up blood will have cancer. So people who are concerned should go and seek medical advice instead of get worried that they might have cancer. And once they see a specialist or someone who can help them, then most of the testing that is done is usually in the form of X-rays. So we do a lot of different forms of X-rays, CT scans.
Yeah, that's I was going really to ask you. Do X-rays really show and reveal what's going on?
Yes, so the simple X-ray often misses a large proportion, but what the more detailed X-ray, which is called the CT scan, the computer tomography, which is basically an X-ray that takes multiple X-rays of your body at different sections.
They use it for pregnant women? Is that?
No, they don't use it for pregnant women.
This is not the X-ray I'm talking about.
No, that's ultrasound is what they use for pregnant women.
But this is a CT scan.
CT scan, yeah. So it gives you higher detail, and a lot of even small cancers can be picked up with a CT scan. Well, you can't tell if any small changes in the lung is cancer just by a CT scan, but there might be some changes that are suspicious that you see on imaging.
Dr. Ghanbar, what are the methods of the treating lung cancer?
That's another good question, and it primarily depends on what type you have. And then the size. I know you have limited time, so we'll probably need to move on. So
it's really interesting, you know, beautiful conversation. We are really learning a lot from you, Doctor.
No, thank you.
But unfortunately, out of time.
Yes.
You know, so what are, I mean, I know there are, but like one method, you know, they say.
They're actually, all patients who have cancer get treated with one of three modalities, either surgery, or they get radiation therapy to shrink the cancer,
chemotherapy?
Or chemotherapy.
So is there a difference between radiation?
Yes, radiation is actually radiation that is targeted to the cancerous cells.
Cells, okay.
And then chemotherapy is a toxic medication that's given to the whole body, but it mainly targets the cancer.
How about the nanotechnology? They say, you know, nanomedical, smart bloods and smart medicine would go to the straight to the cell itself.
So this is fascinating. I'm glad you bring up this point, because I know you have limited time, but I think medicine is moving incredibly rapidly. So right now we're not at the stage of implementing nanotechnology in the treatment, but there's a lot of studies doing it.
Okay.
But hopefully in the future. There are actually a lot of new medications that have
but we haven't
completely changed
yet. Okay, but you know, quick in 2 words, what would you like to say last?
So I think I would like to, if there's one thing that we can do for the community, is to help reduce the amount of cancer and lung cancer, would be to limit smoking as much as possible, and limit spending time with smokers, unfortunately. So either smoking or
absolutely. I totally agree with you. Definitely, you know, smoking is bad, and you know, we always tell ourselves and our kids and our youngsters. Dr. Mohammad Ghanbar, great thanks to you.
Thank you for having me.
That was, dear viewers, Dr. Mohammad Ghanbar. A big appreciation for him, the pulmonary and critical care medicine, advanced lung disease and transplant specialist. Please stay tuned, and we'll be back after this break.